Hello, everybody, and welcome to Connect Health Tech, the virtual pitch competition designed to bring together leading members of the media with startups innovating in the healthcare space. My name is Jim Glade, and I'm a partner at Espacio, which is a media incubator, as well as Publicize, a PR firm for growth. And I'm joined today by my colleague Salome Muriel, who's the VP of events here at Publicize, and she helped organize today's event. We're pleased to be joined today by a host of leading journalists who report in the fields of healthcare, health tech and innovation, startups and business, and much, much more. We're equally privileged to host 6 fascinating startups offering innovative solutions across the healthcare sector. We'll hold a live Q&A session at the end with the media judges. So startups, this is a really good opportunity to ask questions of the media collectively. We have decades of experience and a lot of talent here with us today. Before we begin, and to get us in the mood for today's competition, we do have a very special guest that I'd like to introduce. Scott Sertiven is the co-founder and chief executive officer of Voro, a leading interoperability solutions provider for healthcare and other industries. The company has worked with the American Lung Association, as well as leading healthcare providers and pharmaceutical companies to help improve data operability and patient care. Scott began his professional software development career at the Centers for Disease Control in Atlanta, Georgia, working on software in support of statistical research aimed at controlling the spread of malaria and AIDS. He also spent decades leading complex integration projects at AT&T Bell Laboratories and Bank of America. In 1999, Scott joined a team to work on the Sky Mall e-commerce project and subsequently co-founded Bridgegate, which is now called Voro, and has expanded its offering into the healthcare and data interoperability space. We're really pleased to have Scott with us today to say a few words before. And Scott, if you'd like to share your screen, I'm happy to do so. And if not, of course, no worries either, sir.
No, I'm good. So yeah, so thank you for that introduction. And I want to first off just say thank you to all the judges and the media for attending today. I know your schedules are extremely busy, so we do appreciate that to make this event worthwhile. So again, I'm one of the co-founders of Voro. Our company is over 20 years old, so I have a little bit of history with starting up a company and growing it. So Voro started off as a software development company, and we basically looked for an opportunity in niche market to invent a product and take it to market. We found that in complex systems integration. So our product Bridgegate solves extremely complex systems integration, but it does it without doing any programming. It's a no-code solution, drag and drop. The product has been used in many vertical markets, but we focused primarily on healthcare. That's where we saw the biggest value. And we integrate large healthcare exchange systems, pharmacy benefit management, durable medical equipment, anything in healthcare, our technology has done systems integration with. We're a global company. We do millions and millions of transactions every single day, helping to improve the quality of care. So as a founder, I want to encourage the other founders that it's really rewarding to look back at the start of the creation of our product, where you start inventing it, you build it, you test it, you modify it, you do marketing. And as you're doing today, you do pitches. You're going to get a lot of no's, and don't let that discourage you. Use that as constructive criticism, wear it as a badge of honor. It'll make the yeses that much sweeter when you get to that point. Always continuously innovate, never stop. The market is always changing. There's always new approaches, new ideas, especially with the merging of AI being so popular. Look for good partners and mentors. I've had mentors over the years that have really helped me out with the direction of my company. So don't forget that. But I do want to, I am looking forward to seeing the pitches today, the innovation that's coming out. So I want to thank you, and everyone, good luck.
Scott, thank you so much. And thanks to you as well for taking the time. I know you're super busy, so thanks for those words of encouragement. We'll go ahead and we'll hop right into introducing our media panel. Judges, After I read your bio, if you wouldn't mind just coming online, unmuting and saying hi so we can put a face to a bio. First up, we're really pleased to host for the first time Genevieve Friedman, who is the opinions editor at MedPage Today, a trusted source for clinical news coverage across all medical specialties. Joining the team in 2021, Genevieve is responsible for helping to elevate the perspectives of dedicated healthcare professionals via the opinion section. She's also a member of the content strategy team and a co-producer of MedPage Today's podcast series. And prior to journalism, she worked in health policy and public relations and graduated with a bachelor's degree in health policy from the University of Michigan. Genevieve, thanks so much for being here with us.
Great. Thank you for having me. I'm looking forward to hearing from all the startups.
Thanks so much, Genevieve. Also, we have with us today Jagmeet Singh, who covers startups, tech policy related updates, and other major tech-centric developments for TechCrunch. He previously worked as a principal correspondent at NDTV, which is one of India's leading broadcasters. Jagmeet began his career in journalism as the founder and editor of Tech13, a technology news publication. Jagmeet, thank you so much for joining us as well. We're looking forward to your feedback.
Hi, guys. Thank you so much. My pleasure being here.
It's our pleasure. Next up is we have John Koetsier, who's a senior contributor at Forbes, one of the world's leading business news publications. John has a deep knowledge of technology, managing teams that have created software for partners like Intel and Disney. He's also built VB Insight, the research arm of VentureBeat, which is one of the top tech publications in the US. Before joining Forbes, John was also a contributor and advisor to publications including Business Insider, Inc. Magazine, Read Write Web, and others. He currently hosts multiple podcasts, including Tech First with John Koetsier. John, thank you so much. We're really happy to have you.
Hey, super pumped to be here. Good luck to everybody.
Awesome, sir. Also really pleased to introduce a colleague of mine, Verushka Buonaffina, who's a contributing writer to some of the world's leading publications, including Forbes, Central America, and also Inc. Magazine in the US. A media and communications professional, Verushka is also Vice President and Account Manager here at Publicize, a PR firm that works with technology companies. So Verushka, we're happy to have you on the panel as well.
Thanks for that introduction, Jim, and best of luck to all the startups.
Thank you, Verushka. And last but not least, also very proud to introduce another colleague, Catalina Carvajal, who regularly contributes to Novo Brief, which is an English language publication covering technology and startup news in Spain. She also contributes to Entrepreneur Magazine Europe, among other publications. She is a colleague and account manager here at Publicize as well. And she's also a mentor on PR and communications at IE Venture Lab, which is the accelerator program from Spain's leading business school, IE Business School. Catalina, thanks for joining us.
Thank you so much for having me. Good luck to all the startups.
Awesome. No, thank you so much. And again, we're very pleased to be able to host all of you and for taking time out of your day. Kind of as Scott mentioned earlier, we want to thank you. So thanks for being with us. Without any further ado, let's go ahead and hop into the pitch competition. Startups, I'm going to bring you on in the presenter role, and then you'll be able to share your screens and pitch for 2 minutes. I will be timing you. After each pitch, we'll open up for comments and questions from the media panel, and please feel free, journalists, just to go ahead and shout out or raise your hand and comment. But we're really looking forward to your insight and also any questions after each presentation. To start us off, not an easy task, but I know he'll do well, is Benoit Scherer, who's the CEO and co-founder of Quantitatively. Benoit, give me 1 second, sir, and I'll pass you the presenter role.
Yeah, it works.
Okay, you should be able to share your screen now, Benoit.
Yeah. Can you see my screen?
Yeah, we can see it, and I can also hear you loud and clear. So whenever you're ready, I'll start the timer.
Okay. So hi, everybody. Thanks for having me. and that's good to be here. So we are Quantively, a spin-off from Boston Children's Hospital and Harvard. As a useful primer, we are in the space of AI and radiology, but not for clinical diagnosis, like most, but really for imaging operations, really imaging workflows. And so the aha moment is really the realization that radiology already generates so much revenue, but shockingly operates blindly and could do much more. There is that complete operational black hole where providers don't know much beyond what was scheduled. To make a parallel, it's like if airline companies knew where their airplane was scheduled to take off, but nothing else, which makes no sense. And so there is a lot of gut feeling, there is a lot of inefficiencies, a lot of white space in the schedule, and that represents more than 10 billion wasted just in the US, and also delayed care of patients. And the frustrating part is that much of the data exists, but it is just unusable because it is siloed and messy. And we build Quantively to put some order to this data chaos. Really, what we build is a unified data layer that cleans and harmonizes and structures data and metadata together from many sources, scheduling system, scanners, and more, to provide a completely new data liquidity that, combined with AI, is going to augment staff to help them solve the coordination problem of imaging patients. So, it's really like air traffic control, but for medical imaging. And that's really a win-win-win. For providers, huge impact on the bottom line. Every additional daily patient is up to $300K per year per scanner. For staff, reducing burnout, and obviously for patients, increasing access to medical images. And so, all incentives are aligned, and even ours, we can capture some of the value we create. But more generally, the vision is using AI to solve a real problem with a clear value prop, and also to start with radiology used by every department in the hospital and a primary revenue generator, and then expand beyond radiology. And really beyond operation, we have a much bigger vision about data liquidity in healthcare. So that's Quantively. And thanks for listening.
Fantastic, Benoit, and you came in just under time as well. So not easy to do, but you started us off great, sir. We'll go ahead and we'll open up for questions for Benoit from the media panel, or any initial feedback as well. If anybody wants to start us off. John, I see you're unmuted if you do.
Does it actually improve patient care as well as improve monetization?
Yeah, so patient care is about being more on time and wasting less time in the hospital and knowing what's going to happen. Today, a lot of time, people are saying, hey, come at the hospital at 8 a.m. and you are going to be imaged between 8 and 12. You don't really know. So yeah, we really see actually a true impact on patient care. That's
All right, perfect. John, I hope that answers your question. Jagmeet, we'll go ahead with you, sir.
Hi, nice presentation. Just one thing from my end that I wanted to know, how would you ensure the safety of user data that you collect through this model?
So the safety of data. So here it's not about clinical diagnosis. It's really about operations. So it's about machines. So we don't even need a HIPAA approval. It's really, again, about operation. What are the protocols being imaged? How long it takes? Who reads that? So it's really about operations and not diagnosis. Does it make sense?
Yeah.
All right, thanks, Benoit. And Jagmeet as well. Anybody else have a question? Genevieve, Kata, or any initial comments on Benoit's presentation as well?
Yeah, I have one question. So I think you're measuring how well is the performance of different departments and radiology or imaging. What are some of the key things that you're measuring, and then how do you advise the hospital to improve these things that you're measuring?
Yeah. And so many things, and we start from pretty far. There are a lot of low-hanging fruits because really, literally, what they know is what was scheduled. Like we said about airlines, and they don't know, they don't even know how many exams start on time. They don't even know, hey, if a patient doesn't show up, what to do about that. And today they call each other, they interrupt each other a lot. And by the time they know what to do, time has passed. They just have no data visibility, and so no data to make decision from. It's really based on gut feeling. And so our first step was data observability. But beyond unlocking data, now we tell them what to do about it. And so that is really helping them, optimize in real time the patient workflow. And that also is really what we say in the air traffic control. I think it's a really good analogy because we help introduce an image patient like during the day. Does that make sense? Or?
Yeah.
And even and after we have also what we call, just to add, but the digital twin, and so that is a technological component, but it's really building that digital replica of the department, which is more like models on top of the data that you can pick and poke to simulate things. What happens if I buy a new scanner, if I do more staff, if I hire more staff, if I reduce some exam time. So there are all these simulation capabilities also, so that they can take decisions based on evidence, not based on gut feeling.
Fantastic.
I have a question about implementation. Would you envision it being implemented into existing AI or IT systems? And what would a health system do if they didn't have any existing infrastructure for that type of technology?
Yeah, so we are already installed. We have like all the scanner of UCSF. We also at MD Anderson, at Lewis Children, at St. Jude, at different hospitals. Integration. So today we are on-prem because it's easier. And also, like something to mention, these providers, they send us every single image ever created because they want good analytics on every single image. And so that also is going to open a lot of opportunities with federated learning. But yeah, in terms of implementation, on-prem is easier for them or to go fast, but internally, but we are ready for a cloud deployment, everything like is the correct already. So we could do that. Although when they send every single image, they will need the right pipes to send that. But if they're already in the cloud, we can already get that from the cloud if they want.
Well, Benoit, amazing what you've built so far. So thank you very much for sharing it with us today, and great presentation. Thanks for starting us off.
Thanks, everybody. Thank you.
All righty, folks. We'll move on to our next presenter. We have Nate McClitch, who's the founder and CEO of QuickBlocks. Nate, give me 1 second. I'll pass you the presenter role, sir. I see two open for you. If there's one that you would prefer, I'll give you both, and we'll see what happens, Nate. There you go. All right, one of those you should be able to present with. All right, and you can see you, but I think you're still on mute, just a heads up.
So you can see my screen?
Yeah, now we can see your screen.
Okay, great. Yeah, so basically, let me put this in a slideshow. So we at QuickBlocks are adding AI to real-time communication. So historically, we've worked with a lot of healthcare customers for adding their communication and messaging and video calling solutions. And we've added AI to we've now added AI to the product, and they're offering AI-related solutions on top of the communication. So in healthcare, what's the big problem? There's a lot of security challenges and struggles around doing proper communication. You got a shortage of providers. You got a ton of time-consuming administrative tasks. You got data privacy concerns and poor technologies and tools for user engagement. So healthcare experts estimate that number of healthcare processes are highly inefficient and costs almost up to $1 trillion a year. So what are we doing to kind of solve these inefficiencies in healthcare? And a lot of these inefficiencies are around healthcare communication, as we're adding AI to healthcare communication, which we see can be actually literally a lifesaver. So what does that mean? It means that when people are engaging with some sort of real-time chat or video call, you're able to do instantaneous summaries. You're able to do basically real-time access to AI-related knowledge assistance for healthcare. You're doing things like smart intake through chat, and you're doing it through a variety of kind of ready apps that basically plug into healthcare organizations' existing infrastructures. So we have a HIPAA-compliant smart chat assistant which we have a BA from OpenAI, which enables us to basically create a variety of kind of smart intake and communication related tools, weaving the communication between the doctors and patients or between providers seamlessly. So what's unique about what we're doing? There's lots of chatbots out there. How's our chatbot different? Well, our chatbot is tied into like a robust communication backend. So that means our chatbot can be tied into any kind of real-time communication. So for instance, we've got NextGen, which uses real-time chat within their applications. By adding our communication, they can also add AI assistants real-time to communicate between doctors and patients. We also have got a variety of tool sets which enable easy integration of these widgets into websites or applications. So you can add it into existing software, you can add it into existing websites, you can add it to existing services. So what kind of services are you adding? You're adding things like summarization, knowledge assistance, you're adding transcription, and also the ability to do things like accessibility for translation and other factors. So through this, customers are basically using our tools to add SaaS solutions embedded within their own application or their website. And we're doing this as a plug-inable widget for a smart chat assistant, or they can use this tied in with real-time human handover. So, excuse me, Jim, am I out of time?
Sorry, 10 seconds.
Oh, yeah. So basically, our model is providing communication as a service with AI tied in to remove administrative burdens with hospitals and allow them to easily integrate that within their website software applications to improve patient engagement.
Fantastic. Nate, thank you very much for sharing and a great presentation, sir. We'll open up for questions for Nate as well, or any initial comments as well from the judges panel. If anybody wants to start us off.
Is this primarily, oh, sorry, people have their hands up. Go ahead.
No, I'll go, John. We'll go ahead.
Is this primarily for electronically mediated health, so online or via phone, or is it also useful in person?
So right now, most of our tools are used for real-time communication online, but with the ability to, we also enable our SDKs within mobile apps, so people could actually, in theory, add the communication to create like an ambient scribe within a doctor-patient visit in hospital. But effectively, customers are taking our tools to kind of automate things like patient intake through AI, and then provide that summarization to a healthcare provider or admin staff so they can really come up to speed very quickly. And it kind of removes a lot of administrative burden. So we're seeing a lot of benefits between adding AI on top of communication workflows today and building and giving them tools to be able to build their own workflows. I don't know if I answered your question or not, but hopefully I did.
And feel free to follow up, John, if you want to press. Okay, cool. We'll go with Verushka and then Jagmeet.
Awesome. Nate, that's a very interesting thing you're building. I do have a question from the patient perspective. I mean, how does it actually work? I mean, is this going to be like a regular chatbot where we'll have like this predetermined answers and we have to pick in order to kind of find the answer to the question that we're looking for? I mean, how does it actually work?
So what we've done is we added generative AI into like a real-time communication SDK. And what does that mean is that the AI has its own intelligence you can train it up with. So it can do something like index a website, you can take PDFs, you can upload documents. We're using a technique called RAG, which I'm sure most people are familiar with. But on top of the RAG, we've added some logic so you can basically program to do things like a human handover if the AI is not able to answer the question. Or you can syndicate that AI to like another service to basically look at answering the question. So what we've tried to do is seamlessly figure out how we can add generative AI tools into like your real-time chat or your video call. And so what we're seeing with our customers right now, we've got a customer in the musculoskeletal space. What they have is they've got an app in the App Store. What they're doing is a smart patient intake where the AI is asking a number of questions. And then once the AI summarizes it, it's actually coming back with some advice. So in this case, it's musculoskeletal injuries. So, hey, elevate, put ice on it. but then the provider real time is getting a summary of what's happened with that patient. They can see what happened with the intake form, and then they can use a knowledge assistant to then basically answer the questions with them as well. So there's a lot of programmatic things that the end provider can do to customize it to the patient themselves, if that makes sense. So they're not stuck in some box of just a chat bot. They can actually put some knowledge around it and then basically route it to the right destination.
Okay, thank you.
We'll go with Jagmeet and then we'll wrap up with John.
Yeah. Hi, Nate. So
Hi.
a couple of questions. One is around the competition. Who do you see as your key competitors in that market? And the second one is, since you're using AI, so is it an open source solution that you're using behind the scenes, or is it like OpenAI or some other closed source solutions that you're using? And how would you ensure, since it's more about patient data, so how would you ensure that all these kind of solutions that are there in the market that you might be deploying there are not actually grabbing that data and using it for training their own models over time?
Yeah, no, those are some really great questions. I think there are four of them. Let me try and break them down a little bit. So first of all, it's not a secret in terms of which model we're using. We are using OpenAI because we have a BAA from them, and the importance of that is it's non-retention. So the assumption is everything that gets put within the system shouldn't be passed back to OpenAI for training. That being said, we're basically look at AI as basically an integration play. So there's probably going to be a variety of other AI related tools that we would tie into the real-time communication workflow to enable better efficiency of processes. So like to give you another example, we have video calling functionality. So we've gone to another AI provider to do automatic generation of SOAP notes and ICD-10 billing codes and other areas. So I think with AI means a lot of things to a lot of people, and there's lots of different flavors. But what we're seeing is that the whole communication layer, which is where we came from, there's different ways you can weave in AI to ease administrative processes, right? So in that case, like I mentioned, like the smart intake example, or basically providing a real-time knowledge assistant to a provider or to an admin staff who could do there, or having the AI actually become agent-based and be able to like book them appointments so you remove some of these administrative burdens, and all through an interface that people are very used to using today, which would be chat or potentially video calling. I think I might have missed one or two other questions, but in terms of security, we can also deploy the software within the customer's own premise, so they can basically ring fence it, so they control who's got access to those databases, that knowledge. And clearly, we do have PHI within our system, basically when it comes within it. So we have SOC 2 compliance, and then we also ensure that each of our parties have got BA coverage on that as well. And we try and practice good security practices to ensure that that data is encrypted and safe at rest. Was there one other question I missed, or was there one more there? I'm trying to remember.
Other one was about the competition. Who do you see as your key competitors?
Yeah, so I mean, I think it's interesting because you kind of have the AI pure plays, and then you have traditional things like communication as a service. And I think what we see is that actually communications and the AI are going to increasingly merge together. I mean, we can see that on this call right now where the call is being recorded. So I think AI and communications are going to become increasingly intertwined. And so we see that as actually, a substantial part of growth in the market between CPaaS, where these tools have to be integrated within it. And I guess what we see is, having some easy to embed, widgets and solutions, because I think the other thing AI is doing is making things more low code, no code. So people want to embed these AI functionalities with, human interaction together in that. So yeah, it's a competitive market. On the CPaaS side, we got guys like, Sendbird and Twilio. And then on the AI side, I see them actually more as vendors or suppliers, because I'm never going to be able to build a LLM as rich as OpenAI, but there would be also other LLMs out there and other specific medical ones that we'd want to tie into. Like for a musculoskeletal customer that we're working today, they have their own knowledge base, and so they want to bring that into our RAG to be able to get the questions answered and then tie that into the administrative workflow.
All right, Jagmeet, thanks for your questions. John, I had your hand up. I'm not sure if that was got answered, or
no.
If you wanted
Just a
please.
comment. You have a ton of functionality and a ton of technology. from what we've heard, productizing it and making it specific for this is what it works for might be a bit of an issue. One thing I'll just say, it's just a comment, not a question. If you get patient intake down pat, doctors will love you. Tore some ligaments in my left knee, wrote down all my symptoms for like a month, came in for my doctor's appointment. He read it. He was like giddy because he didn't have to drag it out of me. It didn't take a long time. He got all the information he needed. If you can get that down pat, they'll love you.
Yeah, and that was actually the last call I had before this. I had a meeting, and that was exactly the conversation. It was, someone who was a technology provider to healthcare, and like intake, intake, intake. So I think there's a huge administrative burden and pain around that to have, the AI and the human operate well together to kind of gather the information that is needed by the provider or the admin staff to gather that. So yeah, I think, I'd love to take that, comment with you offline because yeah, we do have a ton of technology, and I think getting them in the right boxes right now at this juncture where, AI and communications are kind of looking together is absolutely key, right? Because I think that's how, we're seeing the market opportunities and we're seeing recurring use cases.
Thank you, John. And we'll wrap up with a question from Genevieve, or comment.
Great, thanks. I think it's actually a good follow-up to John's comment. So I just was wondering, when you were building the product, did you envision it being most applicable to one type of, facility or healthcare space in terms of having the greatest impact? Because, I think there are different applications of this, whether you're looking at private practice, a busy ER or a large healthcare system versus small. So I guess my question is, when building it, were you targeted to one type of space, and beyond that, do you envision it being applicable more broadly?
Yeah, I mean, that's a great question. So we came out of like the AI revolution in kind of a slightly different way. So we were providing already the communication tools. So we were providing, things like chat and video calling and file sharing where people could take, SDKs and APIs to integrate that within their own existing application. So like our viewpoint was, okay, people are using this, they want to create like their real-time messaging and communication. And so then when AI came through, the point is AI is basically, chat is basically a command line. You tell the chat what to do and you expect the AI to do something with it. And so from that point of view, we had to think about how to support like a core, more general use case. So if someone wants to add AI related functionality on top of their communication. And then we had to think about, some very specific use cases that we see recurring within healthcare. So one of those was around, telemedicine, virtual consultation. And so we have a off-the-shelf product, which you can plug in and the source code is open, you can white label. And that's got basically an AI-powered telemedicine, teleconsultation visit. And then we've actually created some website widgets, just really simple chatbots, plug into your website, which have the trainable AI assistants. And then, but the key difference is we're tying that in with human handover. So I think you're correct. There needs to definitely be segmentation. The nature of our product, applies itself to like large organizations and deeper technical integrations. But I think, at the individual practice level and at other areas, we're seeing kind of the same kind of, headache problems around, hey, how do you get intake? How do you, gather information effectively? How do you free up administrative staff, in a time of limited resources and high constraints? Because, I think pretty much every market in the planet now is a doctor shortage because everyone pulled the ripcord after COVID. I don't blame a lot of them, but so I think, AI has to come in to make these processes more efficient, especially considering the costs and complexities of healthcare.
All right, well, great follow-up questions from the media panel. Thank you guys so much. And Nate as well, great presentation. Thank you very much for joining us today.
All right, thank you so much.
Of course. Happy to bring up our next founder. David Tess-Joring is the founder and CEO of HealthKey. David, give me 1 second, sir, and I'll pass you the presenter role.
Sounds good.
Okay, you should be able to share now.
Can you see my screen?
Yes, sir. Whenever you're ready.
Right, perfect. Great to be here. Great to meet you all. As mentioned, I'm the CEO and founder of HealthKey. We're a multi-sided marketplace for health services. So it's probably not unknown to anyone here interested in health tech. There's a boom in new preventive solutions, better and better treatments, better and better healthcare in general. but what's really broken is the way that it's accessed and paid for, and making these developments available to a wider group of people. So my co-founder and I, to my co-founder and I, 18 months ago, launched HealthKey to build access that puts the interest of people first. And this is around emphasizing prevention and proactive health, having 100% transparent pricing with access to wholesale pricing. And how this works is a multi-sided marketplace that aligns the incentives of all the stakeholders. So on one side, we've got employers, insurers, HSAs, member organizations, and self-pay. Essentially, think anyone that's willing to pay for you to stay or become healthy. And the other side, health providers, and wide range from primary care, digital therapeutics, pharmacies, digital services, all the way to fitness and wearables that helps us stay healthy. And the way it works is an individual uses our front door, very simple online platform to find the health services that they're looking for. And we then integrate directly into the native flow of whatever the health provider is. So whether that's a booking form, a triage, to an app, and we're then embedded in the payment journey. So once you get to a payment situation, you have the option of paying with HealthKey, and this is both for those that are digital, so already have digital payment solutions, or those that normally use invoices. We give them this as simple to integrate as a Stripe integration. Looks and feels like a Google Pay or a Klarna, but if I click it, I'm told what's the discount I'm getting for this product, how much is my employer paying, how much is my insurer paying, and what's left, if anything, for me to pay. And then that's what I'm paying. Now, what's interesting is not so much what is here, it's what's not here. And there is no out-of-pocket payments. There's no reimbursement process needed, and there's no risk of a surprise bill. The business model is quite straightforward and simple marketplace model. So we take a transaction or a revenue share fee for transactions, whether that comes from the individual insurer or employer. Employers can give people access, well, they're self-insured and they're paying for it. They also buy subscriptions for primary care access for the employees. We launched the product 12 months ago and we partnered in the UK. We partnered with the third largest insurer. We've integrated more than 60 health provider networks with more than 200 pathways. Part of what's interesting is our largest user group are not the traditional early adopters, actually blue collar workers where the monetary impact is bigger. Currently scaling across the UK, launching in the US later this year, and building a wait list of US employers and organizations.
All right, and time. David, thank you so much for sharing. Really cool what you're building, by the way. I definitely could see some use in that. So thank you very much for sharing with us, and congrats preemptively on your expansion into the US as well. I imagine that's why you're in Atlanta today.
It is.
All right. We'll open up with some questions or initial feedback as well for David after his presentation. Anybody want to start us off?
Sure, I'll kind of a comment. I saw that you said somewhere puts people first, and I had immediately I was thinking which people, because if it's people accessing healthcare services, then the people who want the money are probably not as happy. So which people?
Yeah, so we do, it's a good question. We do see that the people accessing it, but aligning the incentives of the payers. So part of integrating directly to employers and member organizations, also some, well, now integrating with insurers that are interested in prevention, but finding that a lot of the unwanted cost that goes into billing processes, we can take that away and reduce the costs. Particularly if looking at self-insured employers, the ROI in prevention is quite good. So there is an interest from the payer. What has proven, I guess, surprising to some is the health provider who are, say, getting paid less in terms of the discount, the wholesale pricing, the cost that normally goes to billing and reimbursements or customer acquisition costs for the more preventive sides is what we can take in terms of discounts and revenue share. Particularly also aggregating blue collar workers, contractors, smaller providers, smaller employers together helps us bring that procurement power. So we do believe that while, yeah, cheaper healthcare is not always great for the provider, they might want to keep the prices up. Their business models have those discounts already for the insurers, so the business model works. So if we can take away some of the pain points, so far that's proven the easiest side of the marketplace.
Thank you, John, for your question. Any other follow-ups for David? All right, David. Well,
will people, yeah, I have one
Go ahead,
question.
Kat.
Will
For
people
sure.
have access to this marketplace through their employer, or just like normal people can access to it?
Anyone can access to it. What we target is employers, unions, other organizations that pay, because if you currently just sign up as an individual and we're not integrated with any of your payers, we might be randomly already with your insurer or union, but otherwise you just get access to discounts. So our go-to-market is through the payer, but anyone can sign up and the individual owns their account. So they take that with them, which also means any history of payments, history of treatments, you take that with you. So it's not linked to your employer or your health plan.
All righty, David. Well, great presentation. Thank you so much for sharing. And again, congrats on expanding into the US and everything you've built so far.
Thank you so much.
Sure thing. All right, we will bring up next Ganesh Padmanabhan, CEO of Autonomize AI. Ganesh, give me 1 second, sir, and I'll go ahead and I will pass you the presenter role.
You guys can hear me okay?
Yes, we can hear you. Yeah, I think loud and clear. And if you'd like to share your screen, Ganesh, you should be able to do so. All right, cool.
Very cool.
It looks like it's loading. Awesome. Yeah, whenever you're ready, Ganesh, we can begin.
All right. Well, hello, everyone. I'm Ganesh Padmanabhan, founder, CEO of Autonomize AI, and we're building AI co-pilots for healthcare to reduce the administrative burden, which has been the theme of the day today, for knowledge work in healthcare. To tell you more about what we do, let me tell you a story. And the story is about Michelle, and she has to go through a breast scan for screening for breast cancer because of some family history. But to go through that, her provider has to send the request in a process called prior authorization to her health employer or to the insurer. Here's why it's a problem. It looks like this. The doctor fills out a form, attaches tons of medical documentation, sends it over. And it's worse on the health plan side, where they employ hundreds, sometimes thousands of nurses to review this, take this case, adjudicate that against thousands of pages of policies, and make a decision. Michelle doesn't hear back for 2 weeks or more. And there's always back and forth and stuff. It's a very terrible experience. We've changed that with this notion of a prior authorization co-pilot, where we automate the intake of these cases. This is a health plan view, where all of the data, we use a vision transformer model to intake. Koetsier doesn't work very well from a core technology perspective. We adjudicate that against compliance all in a matter of minutes and give the update give a decision for the patient, for the actual health knowledge worker, to make sure that they can make a decision, and Michelle hears back in a matter of days. Hundreds of workflows like this exist across healthcare. And there's, like I think somebody else also called out, there's $800 billion spent in manual administration of care. That's almost one fourth of the entire healthcare GDP. And most of the problem, the underlying problem is that most of the data that you have to deal with is unstructured, siloed, not clean, but also has to be paired with the right context, which is what we do with our co-pilots. So we have built co-pilots for tens of different workflows across that are high quality workflows, where we focus on augmenting the healthcare knowledge worker, be it the nurses, the caregiver, the doctor, the MD in the picture. Primary focus has been in health plans, and we also support a lot of researchers in life sciences, where we turn multimodal unstructured data into multidimensional experiences through these co-pilots. And we are HIPAA SOC 2 compliant as well, and we deliver value in a very flexible manner. We deploy very quickly, has been very good at delivering value within the first 12 first 12 months or less. So we've been around for 2.5 years as a company. We've had the best year last year, and the last 2 quarters have been great. We power several top 10 pharmaceutical companies. We're powering several of the workflows within Fortune 100 healthcare insurance companies and value-based care providers. The most exciting thing is the actual case studies that's coming out, how fast you can automate or augment the knowledge workers to perform their function and then deliver higher quality care for the patients. The reason this is actually critical, the last 4 years have told that the healthcare knowledge workers, the nurses, the caregivers, the researchers, the MDs, are fundamental to transforming patient care and delivering value to care. What we're really doing is giving every one of those knowledge workers, the Tony Starks, we are transforming them to Iron Man and Iron Woman to deliver work at a much higher pace to better patient care at an improved quality as well. That's my quick update. My business model, we are a SaaS, a SaaS model with also some associated attached services, and we deliver value, in a high-touch fashion with customers, with healthcare customers.
And time. Ganesh, thank you so much. Fantastic presentation. Really appreciate you sharing with us, and yeah, it seems like you're saving a ton of time and headaches. We'll go ahead and we will open up for initial questions or feedback from the media panel, if anybody wants to start us off.
As someone who's used ChatGPT to understand medical records and MRI scans and all this stuff, and my mom's blood scans, super helpful. As someone who's like thinking about, okay, now they're going to use AI to say no more frequently and just faster, scares the hell out of me. I understand there's a reality in the States of HMOs and what care fits and what care doesn't fit, and there's nightmare stories about that from people doing the job. Doing it faster is great. It's better. It's wonderful. I just hope that some of the savings get redirected to helping people more frequently.
Now, I know it was not a question, John, more a comment, but I totally hear you, feel the same sentiment. I think, the 2 things I would say is, like, one of the things, our initial focus had been not about automating most of these workflows, because automation is, it's a horse that's beaten to death, and it's still happening. There's still a lot of opportunities. But augmenting and really bringing out what's really good about the knowledge workers to begin with, right? And in this case, is like, these, the prior auth nurses in health plans are actually pretty damn good. They understand the human nature. They'll see that 8 out of the 10 criteria is not met, but then they see that it's a pregnant woman. She is actually being, she lives far away from where the procedure is actually being done. She's going to make a human call and make that happen. But the problem is, if you think about the flip side of this, is the fact that that information about her pregnancy and her address, it'll probably take her, 30 minutes to actually search for it or ask for it if she doesn't have it and get there. So what we're trying to do is solve the problems of, how do I reduce the cognitive load of doing things that is not necessarily value add or unique to that healthcare knowledge worker to do it. Now, that said, fast forward a little bit more, I do think there is one of the biggest problems in healthcare is like all these multi-party incentive systems, and not everybody looking at the same piece of truth, right? So there is a larger opportunity where you have all of the data being curated by AI, and you're now having a consistent, imagine we do prior automation or augmentation for health plans. We also do it for healthcare providers, value-based care providers. And at some point, if you can actually have this, from an evidence-based medicine perspective, the quality of data generated on either sides can be much higher quality, then decisions can, it's bound to actually make a difference in patients' lives. Now, there is definitely the incentive thing. Jagmeet has a question, sorry. Thanks, John.
Hi. Nice presentation. I have a couple of questions. One is around the part of the defensibility, since there are a lot of startups that are trying to solve this kind of problem there and building a lot of co-pilots using a lot of solutions available in the market, maybe from OpenAI and other companies there. And what is going to be your sense there in terms of being in that business for so long? And the other one is, one of the kind of follow-ups on that is that, how do you see the hallucination problem there, and what is your take on tackling that down? I know that it's not something that you can solve it to a large extent, but it's something that you can limit to some extent.
Yeah, no, it's a lot of different things in there. And I since it was 2 minutes, I didn't go into a lot of that thing. I'll give you a couple of quick things to do. So first off, I think the defensibility that we build in, it's so we're building, it's not just a thin layer on top of an LLM. So there's a lot of thought being built in. We're pioneering a model called compound AI, which is the ability to mix large language models, which are very good at generating general purpose prose and text, with more narrow, unique, highly specialized models that we have trained on medical data year in, year out. So that solves two problems, right? One is the ability, so we call this agents, and these agentic workflows can be combined together as a co-pilot, which is also how we're able to go from one function like prior to HEDIS quality reporting to patient engagement to care management and so forth very rapidly, right? So that's one. So there's a technical element of composability, smaller, more expert models that can be combined with, the large language models and the orchestration layer. There's that one part of our defensibility. The other part of defensibility is actually our clinical expertise. So the chief clinical officer for Elevance Health is our chief medical officer. Used to be the chief clinical officer until recently. He's now our our head of strategy and chief medical officer. We have assembled a team of clinicians who understands this domain space. One of the biggest problem, and I mentioned this earlier briefly, which is it's not just about content transformation, which you can use an ML model to do, but it's about capturing context. And one of the biggest, investment that we have made over the last 2.5 years is how do you capture the context that are there in these experts and then apply that through knowledge graph, through technical techniques into the products and the workflows. So that, we have built some unique capabilities around that part too. And then the last thing I would say is we have a pretty strong distribution through distribution networks. We have resellers. We have other folks who actually already sell to healthcare and have customers. They take us to market. An example being Lyric Health, which is a claims extends, a 30-year-old product. Everybody has it. They, resell our capability through this thing. And so there's a lot of, individual pieces in there too, but I think a combination of a core technology, which is more deeper than an LLM or a prompt layer over LLM, plus the clinical expertise and the distribution pathways or defensibility. On the hallucination problem, I think, like I said, if you were just using ChatGPT and you can do it, it's very nuanced, right? If you run a medical record on ChatGPT and say summarizes for us, I can guarantee you will see instances like, say, running high temperature will automatically, ChatGPT will hallucinate that as a fever. And it's not a big hallucination, it's a micro hallucination. Those things are actually very dangerous in healthcare, right? So what we do is actually, we do a combination of smaller models that'll actually constrain the context and use the LLMs where they're really good at, which is generating prose, generating summaries. So the context for the summaries is pulled by smaller models. So that's why we're actually, we publish scorecards with our customers. We go through a validation thing. The short answer is there's no easy answer, but there's a variety of techniques that we use to ensure that we lower hallucination and improve quality of responses and so forth.
Thanks, Jagmeet. Does that answer your question? All right, perfect. Well, Ganesh Padmanabhan, CEO of Autonomize AI. Ganesh, thank you so much for presenting. It was a great presentation, dude.
Thank you.
All right, folks, stick around. We have two final presenters. Very excited to host them. I want to thank, first of all, the judges for following along and scoring in the judges' scorecard. It looks like everybody's up to date, so thank you very much there. We'll go ahead and we'll bring on our next founder, Martin Becerra, who is the founder and CEO of Puramente. Martin, give me a second and I will pass you the presenter role. All righty, Martin. You should be able to share your screen now.
Perfect.
All righty. Whenever you're ready, we can hear you and see you as well. So whenever you're ready, sir.
Hello, everyone. I'm excited to introduce you to Puramente. It's the leading meditation app in the Hispanic world. So our mission is to deeply transform how people handle the constant battles of modern life. As one of our users, Maria, shared, it wasn't until she really discovered meditation that she found a way to manage her mind and enjoy life more fully. So our app is the best rated globally in the category, featuring an extensive library of content and providing personalized session to meet every user need. And our community approach includes live sessions that foster community and engagement and support. So Puramente is dominating the Hispanic market. It's generating more downloads than all its competitors combined. And this year we also launched in English, aiming to establish a strong presence within the Latino population. So this is not only about meditation. We are building a complete mental wellness ecosystem that includes courses, therapy, coaching, and other services guaranteeing a holistic approach to well-being. So financially, we've been very strong with our seed round of 1.8 million, with over 5 million downloads so far and 1.2 million in ARR. We are really going towards becoming a key player in this 42 billion market. So we are seeking to meet strategic partners in the US to help distribute and integrate solutions. So if you're interested, please feel welcome. Thank you.
All righty, Martin.
Will the name stay the same in English-speaking countries?
Yes, we are testing. We initially launched with the same name. We are seeing how it goes. But yeah, at least at the beginning.
I have a question. You brought up a bunch of competitors. Clearly, you know that, there are a lot of people in this space. What do you think differentiates your app from your competitors?
Yeah, totally. The points that we mentioned, the community approach, it's really making a difference. People really feel some kind of loneliness during the learning process. So really helping with live session, with courses, it's making a difference in the journey towards a better well-being.
Did that answer your question, Genevieve?
Yeah, I mean, I guess if you could expand a little bit on when you say community approach, do you mean that people using the app are connected to other people using the app?
Mostly, yeah, we have live session. That's the key element for us. So the people can participate in small groups with the teacher. So that is mostly the feature that we have for that.
Okay, great. Thank you.
Yeah, thank you.
Thanks, Genevieve. Any other questions for Martin? Kata, I see.
I think like one of the biggest problems with these apps is customer retention. I myself have downloaded Calm and then stopped using it after like just a few months. So what are you doing in terms of like customer retention, keeping people engaged and so they don't forget out about it and stop using it?
Yeah, great question, Catalina. I would say you, as a business, you need to be on top of the trends that top tier apps are using, but that's not enough. That's why we started adding more layers of engagement, like as I mentioned before, live session. We also add cohort-based courses. So all these kind of extra solutions helps to really go deeper in the offering and in how the user can make a commitment with himself. So that's one challenge, but there is very helpful solutions.
Catalina made a great point. Retention is a real challenge. Check out Weltery. They have 57% retention after 3 years, which is absolutely bonkers, insane, unimaginable, unbelievable in the mobile app space. And they do some very, very interesting things to make that happen.
Thanks, Sean. How is the name of the app?
Weltery. I'll put it in chat.
Thank you.
We'll wrap up with Verushka.
Yes, Martin, my question is much more on the qualifications of, you said there are going to be sessions like webinars, teachers. I mean, what are the qualifications of those that are leading these meditations?
Yeah, great question too. We are opening the spectrum, offering different categories between the wellness space. So some categories are communication. So we are partnering with specialists in, for example, nonviolent communication, or some specific categories. In coaching, the same. We are identifying the space where we are where it's more relevant for users, and trying to make a very very precise process selecting the professionals. In any case, I think that's the problem. The biggest problem is on the other side of the market. It's how to get the users. So there is a very big opportunity getting together some very qualified teachers that are they have really difficult time finding the clients. So there is that's something that we are very confident.
Gotcha. Martin, thank you so much for a presentation. And I got to say as well, you look like you also use your platform, because this was the most calm and relaxed I think I've ever seen anybody present. You do well under pressure, sir. Congratulations. We'll go ahead and we will bring up our last presenter. I'm very happy to have with us Sofia Membiela, who's the founder of Zalameras. Sofia, give me 1 second and I will pass you the presenter role as well.
Hi, thank you.
All right, you should be able to share your screen now. Yeah, welcome. Thank you.
Okay, just a second.
Let me know if I need to pass it back to Sophia if there's a problem with the Zoom.
Oh, should be okay now.
Okay, cool.
Okay.
There we go.
Okay. So thanks everyone for having everyone gathered here and fostering this space. My name is Sofia and I am the founder of Zalameras. The brand is a digital native brand that focuses on offering organic and natural lingerie to join technology and the advances that lately the industry has been making in the new fabrics and design with a sustainable approach to production. I originally came up with the idea as I was studying medicine, and I was really inclined to dive in deep by myself and read a little bit on endocrinology, public health, and why everyone was so concerned with fertility. It seemed like a problem that a lot of couples and a lot of women were having. I bumped onto a lot of studies and papers, and many of them suggested that lifestyle choices were a very big factor of this. Most of those tailored different measures, but very few of them talked about endocrine disruptors that can be found in clothing. And petrochemical fabrics have been proven to disrupt hormones and be causing infertility. So despite this not being talked about so much in mainstream media, the intent of women looking for answers is clearly there. And so I ran to my drawer, I looked for the labels and what were the components of all of these fabrics, only to find nylon, latex, polyester, and many more. I went online and I couldn't find any other brands that were producing underwear that didn't have all of these components that were making a lot of conditions worse, not only fertility and conditions that lead to this, PCOS or endometriosis, but also autoimmune diseases, skin conditions like eczema and psoriasis could also worsen by using these. So this brand combines partnerships with a lot of other startups that happen to be also founded here in Spain, like Pyrotex, that makes fabrics out of natural textiles like algae, rose petals, or like plants, aloe vera, and make the most out of their natural skincare components and make them suitable for producing. We also partner with Recovo, which is a startup that takes the remnants of production from other factories and offers them to startups. And we're not only sustainable, but also organic and make the most out of sustainable production and proximity economy, since we all partner in proximity businesses. We don't
10 seconds.
Thank you. We don't sacrifice design for performance of these garments. And the brand culture is very important since we plan on building a community around this brand. The roadmap is we're currently in our second batch of prototyping. We have a private email list. We will pre-launch on October this year, and the official launch will be on November this year too. Sorry for the typo. And
awesome, Sophia, I know it's a ton to add into just 2 minutes. So apologies, I'll have to cut you off, but a fantastic presentation, something that I had no idea about actually. So very interesting. I'm sure there'll be a bunch of questions for you. So we'll open up for questions for Sophia from the media panel or any initial comments as well. Anybody like to start off on Genevieve? I see.
Yeah, I can start. I think this is a really interesting idea. And definitely with you that, women's health doesn't get enough attention. And I think this is a great time for it and an important topic. I guess one question is just in terms of more the business model and pricing. How do you plan to balance, potentially a higher price point to produce these products with making sure that they're, affordable to people and people will actually consider buying them when taking into account the health implications?
Yeah. So this is something that I also wondered as soon as I started planning all of the production. All of these fabrics are really expensive since it's not only what they're made of, but they're so recent and the developments have been made like almost no time ago. The good thing about it is that the longevity of the garments is way longer than usual polyester or nylon. Also, the approach of the brand to buying clothes is not the same as a lot of brands may suggest, like the more you buy, the better. We just want people to buy like a pair of garments, see for themselves, like they last long, they're good. You don't need 50 pairs of underwear, but longevity and investing in things that are going to upgrade not only like your drawer or your wardrobe, but your lifestyle, and you're comfortable wearing them knowing that the investment that you made is aligned with the lifestyle choices that you're making. I think that matters a lot more to people. Yeah.
So I guess, I don't know if this is something you've ironed out yet, but how much would one pair of underwear cost?
For a bra, it would be something like 60 euros. Because we're over here in Spain. It's not so far from other like premium brands that offer, like great marketing. They have some history that backs them up. But I think we have that covered with a community that we're building, and you get the other benefits of being in peace with knowing that you're wearing something that's not damaging you. So
great.
As a
Thank you.
man, I was like, holy shit, 60 euros for one pair of underwear. But I understand everything is more expensive for women, so maybe that's normal. I have no idea. The golden age of D2C has been like a couple years ago, right? When you still had IDFA on iOS, so you had device identifiers. A third-party cookie had lots of runway, and it doesn't as much anymore. And so marketing on Facebook, it was very easy to find your target market, and then also find sort of lookalike audiences and stuff like that. What's your go-to market strategy in a world where targeting is more challenging?
I share your concern because I am a growth marketer, so I've been very affected by this. But yeah, I think definitely having a very close contact with your the segment of people that you're going to be ideally selling to is really important. Knowing where people are in the internet isn't as hard as it might look like if you understand the consumer well. The one slide that I didn't include is the one where I describe in detail what our ideal consumers are and what their hobbies are, what they're doing, where they're hanging out in real life and in social media. So our consumer loves social media. We are talking about younger women that are in this age of like wondering, are the symptoms normal? Are other girls feeling like me? I want to have children. Why is it taking so long? They're looking for answers that out on the internet, and we know where to find them. I think the key once you find them is to get them together in sort of a group. Well, we all share the same concerns and the same ideas, and keep very close contact with them, whether that's like private members groups, social media. We also have a very specific approach on how we want to play social media. We are on more like a premium segment due to the pricing of this underwear, but we don't want to do premium communication like other brands do. We want to be very close to them. We want to do UGC. We want consumers to have a say, ask them, have their feedback. On my last slide was some philanthropic and studies that we want to do. In the future, I would love to partake actively in developing new fabrics and also partake actively in developing new studies. And I would love to ask our members, what would you like to know? So we know where to invest the money on studies. What textiles do you want, or what type of texture do you like in your underwear that you want to see developed? So yeah, I hope that answers.
I'm wondering as well if there might be an inroad, kind of the medical route too, with like OBGYN or any type of, maybe there's a fertility like kind of association or something like that. You might have an inroad there. I see Verushka. Maybe we'll wrap it up with one more question from you, Verushka.
Yes, Sophia, very, very interesting indeed. For a brand that's looking to be sustainable, I think one of the key is to have traceability, right? So understand the whole process. How do you feel that Salamera will able to control from the raw material until the garment is placed on basically in the hands of the consumer?
This is very interesting. Well, now just recently, the European Union is planning on launching a digital passport for clothing, which is really nice for the whole industry, not just the sustainable ones. That we have had a closer focus on that. And this plans on tracing from the sourcing of materials back until even after the clothes have been disposed. We ensure this by having very close contact with the people that we work with. Our partnerships, Pyretex and Recovo, they're all based in Spain. And if we outsource anything to other manufacturers, we also make sure that they have all the certificates in rule. And we ask very detailed questions about where things are coming from, where are the conditions of this production and the workers involved. So we know from the start where the things are coming from. And once we have them, everything is in very close contact. Now the production is not so big, so it's really easy to maybe look at what we're doing and where things are going. This is just something that just happens to be like that, but we're all girls and we work very closely with production. The factory is maybe like a 2-hour drive from me just now. And the way that I store things now is not so big. So I'm only like 50 kilometers away from that right now too. So everything is really close. Maybe the one thing that will take a longer distance would be shipping to the end consumer, but everything is really looked at.
All right, thank you, Sophia.
Thanks.
Thanks, Verushka and Sophia. Thank you very much for your presentation. Really interesting what you're building. So congrats.
Thank you. I appreciate that.
Sure thing. We will take 30 seconds or so for the media judges to just finalize any scores, make any changes that they want. And then we'll announce the winners. Before we do so, we're gonna open up if any of the startups have any questions they'd like to ask of the media panel. Again, we really love to get those questions answered for you. I'm not sure how far along any of the startups are in terms of reaching out to the media, but would really love to hear if anybody's facing any challenges and wants to ask some questions. So not to put anybody on the spot, I'm not sure, Benoit or David. Benoit, I'm curious for you in particular, it's because it seems like you have a very complicated, obviously, startup, and everything that you're doing might be kind of hard to digest. Have you reached out to the media yet in terms of kind of pitching your story?
So not too much, let's say. And we had a seed round in December. And so one of our partners, I think we wrote like a PR. But at the end, we never ended up to publish about it. At this point, we are also focused. We are focused on developing the business. We are focused on unfolding our vision. And obviously, for sure, we could benefit from it. But you're right.
Well, maybe two questions arise, Benoit, from kind of where you're at, and I'll pass these along. And I'd love to hear from Genevieve, John, and Jagmeet in particular. One is, hey, when is it too early to reach out to the media, or is it ever too early to reach out and let people know what you're working on? And then two, do you have any tips for distilling a very complicated subject matter into something that can be understood by a wider audience? And maybe Genevieve or John, if you want to.
Yeah, it's never too early to reach out. I mean, I don't ever mind if a founder reaches out, hey, I'm working on such and such. This is interesting. What do you think? Or whatever. You may not get a response, but somebody probably sees your email, or at least the title of your email, and it's a little bit of early engagement. Like, I mean, all of us get hundreds of emails a day, and you'll notice them more frequently if it's a name that you remember, that you've seen before, right? Don't expect any coverage until you have like a newsy event, right? Like I Exist is not newsworthy unless you're like, I don't know, you invented faster than light travel or something like that, right? But there's got to be something newsworthy. Sometimes you can attach yourself to something that's happening. And then if you're in some funky way out, far out of left field type of field or area, then we are we're the Netflix of blah, or we're the blah of streaming or something like that. Gets you in a space somewhere, right? Because your hardest challenge is, first of all, getting through the brick wall of all the noise, and then the second hardest challenge is for somebody to put you in a slot somewhere in their brain that is interesting, right? And if you don't fit in a slot in somebody's brains, most human brains are wired to like ignore it, right? It doesn't fit in a slot, whatever, right? So you got to pierce the wall, then you got to fit in a slot, and then you've got to have something cool and interesting and worth time and attention. So you can always reach out, but don't expect something until you meet sort of those three criteria. Sometimes you get super lucky on your first try. Sometimes you bang your head on the wall for like a year and then something happens. Who knows? It's a weird, the magic pixie dust of the internet gets sprinkled everywhere. If you're in something cool like lingerie, it might be a bit easier than if you're in something like SaaS software, which it's just inherently a more interesting topic for many people, right? So you have a bit of advantage, but then, using that and taking that to the next level is challenging.
Yeah, I think John said it really, really well, so I don't have too much to add, but two more quick points I would make. One would be, John talked about managing expectations, and it is hard to get media coverage for, a product or just to break through all the noise. I wouldn't discount the value of smaller news outlets. You might not be in a top tier outlet or exactly where you want to be right away, but I think that, media coverage in any outlet can lead to more media coverage later and can just help validate what you're doing. So I would keep that in mind. You don't have to shoot for the moon, the top tier outlets, and think that that is the only thing that matters. And then the second thing I would say, and I think Jim might have touched on this a little bit, but specifically for you, Benoit, your product is a little bit tougher to digest just because it is so, techie and medical. So I would just be really aware of the audience that you're pitching to and make sure that you are making it really digestible and understandable, because as John pointed out, we're so busy, we get a million pitches a day. And if it takes us longer than we want to figure it out, we're not going to read it.
And just to hop on that as well, what Genevieve said about local, I know in your area, Boston, they're always super eager, and especially, startups that are coming out of Harvard. I think you have a leg up for sure in terms of credibility, et cetera, as well. So any other questions before we move on and we announce the winners as well for any of the media panel?
No, I was just going to kind of observe that, John had a good point there, as well as Genevieve. And part of it is, I guess from our point of view, how do we get more to like the value rather than the technology, right? So how is it actually, because when we talk about the point about triage or intake, like everyone can understand that immediately. But if you say, okay, AI with communications, it becomes kind of abstract. So I guess for us, trying to put that in the right boxes so people can easily understand and see kind of real world use cases about how that's, actually adding value in the real world, right?
100%. And I think earlier, and I'm glad that you brought it up again, triage and intake, because it seems like that's from what John and Genevieve had said is kind of something that has been talked about quite a bit right now as well in the medical space. So kind of leaning on those problems and showing that how your startup can solve for that problem. I see Sophia with her hand up as well. Sophia, if you wanted to go.
Yes, thank you. I was going to ask a question following up on what Genevieve and John were saying about more niche publications. Would focusing on these at the beginning be more worthy of our efforts as founders rather than trying to reach out to very big publications? That would be my
It'll
first
be
question.
easier to get into, and also when you do reach out to a bigger publication and they Google you, there'll be more to find. If there's nothing to find, you don't seem serious, you don't seem real, it seems fly by night. Who knows who the heck this could be? There's no backstory, there's no corroboration. It gets risky for a journalist to write about you because, you know, is it real or am I being scammed here? So having more backstory is always good.
Okay. And also just another question for all of the panels. What makes you like read an email from a founder and be like really excited about like reaching out and wanting to write an article and know more? What makes the cuts from the other ones that are kind of like, well?
That's a really great question. Can I ping that to Jagmeet first as well? I'd love to hear your thoughts as well. Of course, at TechCrunch, I imagine you're bombarded. So how do you decide to click on an email, Jagmeet?
Yeah, thank you so much for giving the chance. So essentially, it's all about, like, as John mentioned, that this is more about, since we get a lot of emails all the time, and it's not about someone at an early stage to talk about anything that we find that it should be sometime later in that journey, but it's more about the idea or the startup should have something interesting in that field. It should be something that can stand out easily. And for us, it's like the bar is so high since we get a lot of emails, pitches all the time, and we don't want to like favor one particular startup and then leave others there at the side. So we just want to be clear that if it's something that is relevant for our audience, then we definitely want to pick that thing from our side. That is the one thing that we do. But yeah, we definitely read all the emails that we get. So feel free to write us and let us know about different things that you're cooking up at your side. Would love to look at that and see if we can develop something, or if not, we can give some feedback or assist you all in any way. So would love to be there.
And Genevieve, I don't know if you have any follow-up for that as well.
I think that was great. I would also just say, you know, we are busy. We're trying to cover the news, what's going on. So, you know, anything timely or tied to something going on in the broader tech or global landscape, you know, if there's a timely element there, a newsy element, I think that'll help.
Great, thank you.
All right, guys. Well, thanks so much. I know we're actually running up on time, so I do want to announce the winners. I invite everybody to unmute really quickly, and we'll announce the third, second, and first place winners, and then of course we'll give them a big round of applause. But more so than anything, I think everybody did a fantastic job, and really what's more important is you guys are really building some really cool stuff to help innovate and improve the healthcare space. So thank you all for sharing your stories with us. In third place, we have Sofia Membiela, founder of Zalameras. Sofia, congratulations.
Oh, thank you. Thank you.
Very well done. And I know you're very early stage in the company as well, it seems like. So, you know, best of luck in the future. And we look forward to hopefully hosting you again a little bit down the road in another Connect event.
Thank you. Thank you very much.
In second place, he actually had to hop off for a flight, but we'll give him a big round of applause anyway. We have Ganesh with Autonomize AI. Ganesh did a great job, so congrats to him. And in first place, really happy to announce that David with HealthKey will be taking home the first place prize. David, thank you very much for the presentation and a great job, sir.
Thank you so much. Thanks, everyone.
Yeah, you did great. And I hope this is just the first of much good luck in the US for you.
Thank you. Yeah, we're very, very excited to see how it all folds this side of the Atlantic.
Awesome. Well, we're looking forward to it, and we'll be following you as well. I want to thank again all of the other founders as well. Thank you guys. You did a great job. Also, a big thanks to all of our judges today, Catalina, Carvajal, Novo Brief, Verushka, Buonaffina, publicized also at Forbes, John Koetsier, who actually had to hop off as well for another meeting, who's a senior contributor at Forbes, Jagmeet Singh at TechCrunch, and of course, Genevieve Friedman, opinions editor at MedPage today. Thank you very much, all of you, for taking time, and hope to have you back as well. And we'll see everybody next time.
Thank you. Thanks.
Thank
Thanks.
you.
Yep.
Take care,
Thank you,
everybody.
everybody.
Bye.
Have
Bye-bye.
a good day. Bye.